we are. It is 9 o'clock. Thank you, everyone. Welcome our members and welcome everyone. Welcome to the April 5th, 2023 Licensing Committee meeting. My name is Song Oh, chairperson of the committee. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As indicated on the agenda, in the event a quorum of the committee is unable to attend today, where the committee is unable to maintain a quorum, at my discretion, members present can continue to discuss items included on the agenda. Should this occur, the committee will not take formal action on any items. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting and ensure the committee has the opportunity to complete its necessary business. I'd like to ask staff moderating the meeting to provide general instructions to members of the public participating via WebEx. Moderator?
Thank you. This is the moderator. When the committee requests or opens up for public comment, I will open the Q&A feature of WebEx, and I will do that for demonstration at this time. This will open a box or the ability for you to click on the question mark inside of the square. It's typically located bottom right corner of your WebEx screen. And in the text that appear, thank you. Here's a slide for your reference, and there will be a slide for your reference each time the committee opens up for public comment. So when you click on the question mark inside of the square, again, typically lower right corner of your WebEx screen, a text box will appear. In the text box, you will type comment, and before clicking the send button, make sure it goes to all panelists. And then when prompted, click the unmute me button. If you are calling in only, you can raise your hand by pressing *3 to raise your virtual hand. For those that are logged in, you can also raise your hand by clicking on the panelist list and hovering the cursor over your name and clicking on the outline of a hand. That is all for the Q&A instructions. I'll pass it back to you. Thank you.
Thank you, Elizabeth. I'd like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Jake Patel won't be joining today. Indira Cameron Banks won't be joining today. Trevor Chandler.
Here.
Good morning, Trevor. Jesse Crowley.
Good morning, licensee member present.
Good morning, Jesse. Jason Wise is not here, and I am here. Unfortunately, as we do not have a quorum consistent with the agenda, I believe it is appropriate that we proceed with our discussion on the agendized items where possible during the board meeting later this month. As part of my report, I will advise members that no committee recommendations are being offered. I ask everyone participating today to be respectful of the work before the committee today. We encourage participation by members of the public throughout our meetings at appropriate times. We respectfully request that when comments are provided, they're done so in a professional manner, consistent with how the committee conducts its business. I will now open the meeting for public comments for items not on the agenda. I would like to remind members of the public that you're not required to identify yourself, but may do so. I would also like to remind everyone that the committee cannot take any action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Moderator, we're ready for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate in public comment, click on the question mark inside of the square, typically bottom right corner of your WebEx screen. Type comment in the text field that appears, and make sure it goes to all panelists before clicking that send button. You can also raise your hand by clicking the panelist list and raising your hand by hovering the cursor over your name and clicking on the outline of the hand. For those calling in, just press *3 to raise your hand. At this time, no request for public comment. Would you like me to close the Q&A feature?
Yes, please. Thank you, Elizabeth. With no public comment, we'll move on to the next agenda item. Agenda item 3, approval of January 24th, 2023 committee meeting minutes. Members, included in the meeting materials is draft minutes from the committee's January 24th, 2023 meeting. Unfortunately, as we do not have a quorum of members present, we are unable to approve the minutes today. I will request that staff place this item on agenda for the July meeting, at which time we can consider and approve the draft minutes as appropriate. Next agenda item 4, discussion and consideration of provisions for remote processing. Members, as you may recall, we have discussed remote processing several times over the past couple years. Most recently, during our January meeting, we considered several policy questions and received significant public comment in support of making permanent provisions for remote processing for pharmacists working in hospitals and community pharmacies, while other comments expressed concerns with the board taking such action. During the February board meeting, the board voted to sponsor legislation to make permanent limited provisions related to remote medication chart order review for inpatients. These provisions are included in Assembly Bill 1557. We are committed to continue our consideration of potential provisions to allow for remote processing for pharmacists working in community pharmacies such as independent chain specialty and mail order pharmacies. During our prior discussion as a committee, we did not reach consensus on whether remote processing was appropriate for a community pharmacy. I also note that we received public comment from pharmacists currently working in a remote capacity under the board's waiver and potential consequences if provisions are not made permanent. We have also received public comment questioning the boards on legal authority for pharmacists beyond remote processing. As is highlighted in the meeting materials, the board's strategic plan includes a strategic objective to evaluate and change, if appropriate, legal requirements for authorized duties that can occur outside of a pharmacy to reflect the dynamic nature of the practice of pharmacy. As a current chair of this committee, I believe this is an important discussion that both the committee and the board must undertake, but our discussion today should remain focused on remote processing. To assist the committee in its consideration, at my direction, staff prepared draft statutory language to illustrate potential remote processing provisions. I want to be clear that this is intended to be merely serving as a starting point for our discussion. I do not believe the language addresses all of the issues we need to consider, but could provide a basic framework from which we could build upon. Also, to level set, this issue is extremely important and could be of significant consequences. I believe it is imperative that whatever final decision we make, it is consistent with the public safety of California consumers and our patients and our mandate. I believe it is possible that our discussion could span multiple committee meetings. Unless members have any preliminary comments, I would like to briefly review the concepts in the proposal. I will request members' thoughts and will then open for public comments for each concept. Based on our discussion today, I will work with staff to incorporate any changes for our continued consideration at our meeting in July. Members, I know it's a small group today, so everyone just feel free to speak up because it's just 3 of us today. Any comments before we get started?
President Sung, I'll wait until after we go through the document.
Thank you, Trevor. Thank you, guys. All right, so we'll get started here. So the first, and also a reminder to the general public, you're more than welcome to make global statements or wait at the end or make comments for each corresponding items, but all we ask is to not repeat the same comments for the sake of time. So the first general concept provides that the provisions would be limited to California licensed pharmacists performing remote functions within California and on behalf of a California licensed pharmacy. I believe this is important. We're going to allow for remote processing of community pharmacies, but also note that it is similar to the approach the board is taking in Assembly Bill 1557. Members, your thoughts?
Hey, Sung, it's Jessie. I agree with that. I think that's consistent with most of the discussion we had at our previous meeting as well.
Thank you. Any comments, Trevor?
It's the same. It seems pretty common sense to me that if we're dealing with California, it should remain in California to make sure we're holding to our own standards.
Thank you. All right, we're ready for public comment, Elizabeth.
This is Elizabeth. I am opening up the Q&A. It is now open. Instructions are on the screen. If you would like to participate, click on the question mark inside a square, type comment, and make sure to send that to all panelists. If you're calling in, you can raise your hand by pressing *3. I do see a hand raised. Setting my timer here to 3 minutes. I'll give you a 10-second warning before those 3 minutes are up. We will also go through the Q&A requests as they're coming in. So thank you for your patience. John Grubbs, I'm going to send a request to unmute your microphone. And you are unmuted.
Thank you. Good morning. My name is John Grubbs. I'm the Chief Pharmacy Officer for University of California Health. And on behalf of the University of California Health System owned and operated health system pharmacies, community pharmacies, pharmacists, and pharmacy technicians, I respectfully request that the Board of Pharmacy, 1, continue the existing remote processing waivers or otherwise exercise enforcement discretion beyond May 28, 2023 to allow the board more time to gather and evaluate stakeholder feedback related to all of the remote functions that are currently standard practice in operations for pharmacies, pharmacists, and pharmacy technicians. Second, ensure that any proposed legislation addresses remote functions that can be performed by pharmacists and pharmacy technicians. And 3, clearly defines each of the remote functions or activities that are listed in the draft statute, such as insurance processing. I'd also like to offer the following specific comments on the draft statutory proposal for community pharmacy remote processing. First, in paragraph A, allow pharmacy technicians to perform certain types of remote functions outside of the licensed pharmacy, but within the state of California. 2, in paragraph A1, clearly define each of the remote functions and limit the scope of the legislation to activities that are within the scope of practice of a pharmacist or pharmacy technician. That is, only those activities for which a pharmacist or pharmacy technician license is required. For example, the phrase insurance processing could include activities that are performed on behalf of the prescribing physician, like gathering information to respond to prior authorization requests. Activities that are performed on behalf of the pharmacy, like submitting the pharmacy claim for payment, or activities that are performed on behalf of the patient, like helping patients identify available financial assistance. Also, some of these insurance processing activities can also be performed by unlicensed individuals and do not require being licensed as a pharmacist or pharmacy technician. In paragraph A2, requiring an annual certification by the PIC related to pharmacy staffing is overly burdensome and impractical. Moreover, the standards for remote practice should be similar for pharmacists that are employed by a community pharmacy and for pharmacists that are employed by a hospital or clinic who may be practicing pursuant to a collaborative practice agreement. In paragraph A3, requiring each pharmacist to designate one specific location is enormously burdensome, and many pharmacists may perform remote work in various buildings on a campus. It is sufficient for the pharmacy to develop policies and procedures related to protecting privacy and security of patient information, which should include requirements that.
Thank you, Mr. Grubbs. Also, just a reminder that you'll have opportunity to address those again. So you're more than welcome to speak on those items. We're going down that kind of the path. So there will be more opportunities. So please speak up each sections that if you were not able to address all of those. Thank you really for the comments. Go ahead, Elizabeth.
Thank you. This is the moderator. Next individual, John Gray. I'm going to send a request to unmute your microphone.
Hi, good morning. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. Thanks for the opportunity to provide feedback on this important topic. I'm going to give some general comments and then respond to subpart A, and we'll hit the other parts as we go. So we appreciate the licensing committees and the board's willingness to continue to engage on this topic of pharmacist remote work. As you said, Chair O, based on the number of passionate comments to the committee and the board during past meetings, it's clear that this is an important issue for many stakeholders in California. Based on our favorable experience with pharmacist and technician remote work during the public health emergency, we continue to believe that the current remote processing waiver is the best available framework for the statutory changes that are needed to authorize remote prescription processing on a permanent basis. We believe that the more onerous and restrictive the requirements associated with pharmacy personnel remote work, the less likely pharmacy organizations are to participate, thereby reducing the benefits to consumers and the regulated public. A 2022 study by McKinsey & Company found that certain traditionally underrepresented groups have a stronger than average preference for remote or hybrid work arrangements, and may be likelier to leave their job if remote or hybrid work was not available. We encourage the board to consider the diversity, equity, and inclusion implications of any remote work statutory language, particularly as it relates to Governor Newsom's Executive Order N1622. Specifically, moving on to item A, I think number one, we would echo John Grubbs' comments about attempting to keep the duties specified in the statute limited to pharmacist and, if there's technician remote work, technician duties. We would just encourage the board to look at Business and Professions Code 4007B as a kind of guiding principle around how it constructs the list of tasks that a pharmacist may perform remotely, and not specify tasks that are not strictly limited to a pharmacist. And then the other piece on part A would be, we would encourage the board to consider how this statutory proposal would stand separate and apart from the changes proposed in AB 1557 to 4071.1. So, we would encourage the board to specify within the statutory language that these requirements are specific to remote processing outside of the hospital or healthcare facility setting. And I think that wraps up my comments on general comments and my comments on part A. Thank you for the opportunity to provide comments on this important topic.
Thank you, Dr. Gray.
Moderator, next individual. Lindsay Gullahorn, I'm going to send a request to unmute your microphone.
Good morning, this is Lindsay Gullahorn with the California Community Pharmacy Coalition, which is a project of the California Retailers Association. Generally speaking, want to thank the board, the licensing committee, for considering a proposal to potentially provide permanent statutory authority to allow for remote processing for community pharmacies. As I've discussed in prior meetings, many of our members have safely and securely utilized remote processing well before the enactment of the waiver. So we would very much support efforts by the board to pursue legislation to ensure remote processing in community pharmacy settings can continue. Again, as you heard in prior meetings earlier this year, there are pharmacists currently employed by community pharmacies who do their work remotely. And unfortunately, with the waiver set to expire at the end of May, many of these jobs are at risk. There are benefits both for pharmacists and for patients in allowing remote work. Pharmacists working remotely have better work-life balance. Some have disabilities that prevent them from being able to work in a pharmacy, but remote processing allows them to do their jobs at home. Functions that we believe should be permitted include but aren't limited to drug utilization review, prescription order entry, and remote prescription verification, all of which reduce workload inside the pharmacy, reduce interruptions, and therefore reduce medication errors. Functions that can be taken out of the busy pharmacy setting and performed remotely at home allow pharmacists to focus on patient care, which includes things like patient consultations. Medication adherence can and has been safely performed remotely. Pharmacists can call patients and speak to them about drug information to make sure patients are taking their medications correctly and avoiding negative interactions. This type of therapeutic intervention is valued by patients and has been shown to improve health outcomes. With respect to the draft proposal you're considering and discussing right now, we have a few suggestions to ensure this type of remote work can continue, but I'll just focus right now on section A1. It specifies that remote functions can be performed only by pharmacists licensed in California. And we think that there should be authorization for pharmacists licensed in California to be tied to both resident and non-resident pharmacies in order to perform functions remotely. So it would still be a California licensed pharmacist, but that license could be tied to both resident and non-resident pharmacies. As I mentioned, we have other comments, but I'll wait until further in the discussion to raise those. Thank you.
Thank you for the comments, Lindsay.
This is the moderator. Moving on to the next individual identified as Charles Daniels. I'm going to send a request to unmute your microphone and reset the timer here. If you did have your hand raised, we are going through them as the order as they are received. So I did see someone lower their hand. Please feel free to raise your hand again and we will get to you. Okay, so Charles, I've sent a request to unmute your microphone.
Thanks to the committee for this important work and the efforts to collect as much information and feedback as possible. I'm Charles Daniels, currently at UC San Diego Health System and School of Pharmacy. Proud to have been a licensed pharmacist in California for over 40 years. I also speak on behalf of my colleagues at the other UC medical centers and want to specifically speak to paragraph A4 and A5 and specifically ask the board to look at the question of how to categorize pharmacists that are not supervised by pharmacists in charge because they work in a different setting than community pharmacy. As noted above, we believe that standards for remote practice should be similar for pharmacists that are employed by the community pharmacy and pharmacists that are employed by a hospital or hospital clinic or health system. And for that reason, we would like to make sure that we haven't forgotten about those pharmacists that don't work specifically within or associated with the pharmacy. How does this proposal and this legislation impact them? Secondly, I'd like to comment about, well, do you want me to talk about paragraph B now or wait until later?
It's up to you, Dr. Daniels. You will have like 5 more opportunities to consider those comments. Yeah.
Why don't I pause then and we'll come back to that later.
Sounds good. Thank you for the comments.
This is the moderator. There are no further requests for public comment. Would you like me to close the Q&A feature?
Sure, thank you. I thought there was one more, but okay. Well, with that, we heard quite a significant comment, so I'll bring back to the members for any thoughts before we proceed. I absolutely, for me, I hear those concerns addressed by multiple stakeholders. Thank you for bringing that to our attention. Really appreciate it. Members, any thoughts you want to add?
Just a question, Sung. So I know, like, you know, we're kind of going in the questions of or in order of the questions being proposed there. Are we also going to go through like bit by bit through the statutory language after we go through all the questions, or should we just kind of go through things as we go?
So I think that statutory language, I did not anticipate going through it today as detailed, as because this is not something that we're gonna have any opportunity to bring it up anytime. So we have quite a bit of meetings to go through. And I think that wordsmithing statutory language is a bit early. We can definitely use those languages as a starting point of discussion to see if we have issues. So I really appreciate the concerns that are brought upon by stakeholders, but I think that we should start with kind of the bigger picture today.
Okay.
And then we'll try to go, tie that to the language is the thought that, but hopefully it works out, but we'll see.
Okay. Just one question for clarification. Many of the pharmacists we had heard from were actually in a specialty setting. Is the specialty pharmacy considered like part of this in terms of the community pharmacy? Is that what the intention is?
That's kind of a legal question. I'm not trying to dodge the bullet here, but my understanding is most likely yes, but I will defer to Eileen and also to Anne if they have any other information. Great question, Jesse.
Hi, President O. This is Eileen Smiley. I don't know at this point if you wanted to make special rules or ask the legislature to make special rules for specialty pharmacy, whatever that might be. I think that would have to be defined. Otherwise, I would view them as part of this, but that could also be a question directed to the legislature if the board proceeds with its proposal.
Okay, thank you. Yeah, I think I would just considering I think the bulk of the respondents had actually worked in specialty, and so it might be a good thing for future discussions to kind of consider specialty and have deeper discussions on what that means. I also would be curious to see if we could get more information on the number of pharmacies these are actually being used in, and see if there is any information on how many specialty pharmacies are using it versus how many community settings are using it. I don't know if anyone is tracking that data, but I would want to see how many community pharmacies are actually impacted by this processing today.
Sounds good. Thank you, Jesse. We have a person raise their hand. I think that person was the one that actually was during the public comment. I am open to make public comment really quick just so that person can speak, Elizabeth. So we'll go back to that person really quick, and then we'll move on.
Yes, this is Elizabeth. The Q&A is open. Instructions are on the screen. Inez Anton, I'm going to send a request to unmute your microphone, and I'm going to set the timer to 3 minutes. Request has been sent. And you are unmuted.
Good morning, everyone. Thank you so much for giving me the opportunity to comment. I wanted to answer Jesse's question regarding specialty pharmacy. So specialty pharmacy consists of front end and back end. Front end pharmacist, we actually do more like hospital work. We review charts, we do prescription verification, we do DURs, we deal with consultation, we answer stability questions. Excuse me, I just had COVID last week, so I'm still coughing. So it's more like a hospital work. However, back-end pharmacists do, they deal with the final product verification. So the end stage final product verification is done at the back end, where we have the pharmacist who did that. But front-end pharmacists, together with the technicians, we've been able to work remotely for the last 3 years without any HIPAA issues or any concerns. Actually, however, it's in fact improved patient care because we work at pace with no office distraction, and for example, for the last 2 weeks, we had too many colleagues who are infected with COVID or with cold and viral issues, and we're still able to provide patient care while recovering. Although if we have to work on site, half of this team they were called sick. So I really appreciate the question. So I hope I answered how specialty pharmacy runs. So front end specialty pharmacy, we are working remotely for the last 3 years, and it's either core who deal with oncology medications, or COE which is Central of Excellence, and that we deal with a specialty medication for like hemophilia or hereditary angioedema, genetic disorders, and this kind of stuff. I know that 125 members have to go back on site if this waiver has to expire by end of May. And we were planning to go in waves, so like 25 members at time. So it's not like 125 members go back on site at once. I hope I answered your question, Jesse. Thank you so much for giving me the opportunity to comment.
Thank you for the comments. All right, we're ready to move on. So the second concept is about providing that remote processing would only be allowed after the PIC has made a determination that remote processing is necessary to enable improved direct patient care by pharmacists working in the pharmacy. I believe this is one of the most important concepts to me. The board is working very hard to ensure PICs are responsible and have autonomy for making the business and operational decisions at the pharmacies for which they are legally responsible. Members, your thoughts?
Hi, Sung. This is Jessie. I can start with this one. I have significant concerns about this part. While I agree that the PIC should absolutely be involved, the model in community pharmacy as it exists does not allow the PIC for full autonomy, especially in community settings. And so the concern I have is that we are already seeing that pharmacists, including PICs, feel pressured into signing forms that they may not necessarily agree with as is, whether that's to waive their right to a lunch after 5 hours to 6. Sometimes pharmacists are waiving their right to lunch for a 12-hour shift entirely, even if they don't necessarily agree with that. And so I have significant concern that no matter what, a PIC is going to feel pressured into signing things that they don't necessarily agree with because their employer is not only putting pressure on them, but may actually be threatening to demote them, to move them to another location, or have them float it alternatively. And so I don't think this portion really addresses that as it exists today, the PIC does not have full autonomy. The other part that I have concern with is the language regarding reduced staffing levels. And I know we're trying not to nitpick the language, but I really appreciate that part is in there. But right now we don't have transparency in how staffing levels are determined as is. So until that transparency is actually out there, it's going to be nearly impossible to prove that staffing levels were reduced as a result of these provisions. I do appreciate that these things were in the language, but I think just as is, those are the biggest red flags I have right now.
Thank you, Jessie, for the comments. Just so, how could can we figure out a way that we could address those concerns? Can you think of some ways that we could add a layer of protection? I really tried hard to kind of
I know.
find a way.
I honestly, in terms of like the PIC signing piece, I just don't know how you get around the fear of retaliation from a pharmacist signing something. The other thing too is just thinking in terms of the PIC involvement in policies and procedures, especially at a chain pharmacy. The PIC is not involved in developing policy procedures at all. You know, that's all done from a corporate level. And so it would be nearly impossible for every PIC at the hundreds, if not thousands of locations for a particular chain to be involved in that process. So I don't know how that would be feasible. In terms of the staffing levels, if there was a way to include language that would require, notification on how staffing levels is determined, in order to move to a remote processing, then there would actually be a starting point for seeing how the staffing levels were reduced if it were to come up. But I don't know if that's something that we can actually get
How
from
about
pharmacies.
how about we possibly add again, just thinking through, we add something along the lines of if there is a, it it could be a disciplinary action against the pharmacy if they were found to be one coercing the PIC to signing these without them really understanding or, knowing what they are signing on without any input. And two, if the staffing levels were to be reduced and to be found to be reduced after this implementation, that could be grounds for discipline and unprofessional conduct, something along the line of that.
I think the disciplinary action, that would be a good addition. Just with the staffing piece, I think we would have to know prior how the staffing model actually works,
Right.
in order to actually have a baseline to go off, because
Right.
it's nearly impossible to prove.
Yeah. Yep. Okay. Great comments, Jesse. Thank you. That's very helpful.
Yeah.
Any thoughts, Trevor?
Yeah, I want to echo what Jesse was saying because my fear in this is a race to the bottom as far as staffing levels is concerned. And I mean, as of right now, we all know there's a general staffing issue situation within our pharmacies, and very easily right now could be used to potentially reduce staffing levels. Or any number of rationale could reasonably be utilized to reduce staffing levels, and which then inevitably puts more, even though this is being discussed as a way to enhance the efficiency and enhance the quality of care that pharmacists and pharmacists in charge are able to give by taking this off their plate. I have a fear that we could have the exact opposite happens, where in a race to the bottom with staffing, we're putting all this other stuff outside the pharmacy, and then we have less people in the pharmacy. As we're reducing that, then we put more pressure on the pharmacist and the pharmacist in charge itself. So I'm just very, very wary of a race to the bottom as it comes to staffing. And right now for me, like I wish I had a specific recommendation for how we could stop a race to the bottom. And because this is going to feed into some of my other questions about enforcement in general, I know we as the board and board staff are very stretched when it comes to enforcement already, and adding a new kind of amorphous labor staffing requirement is, I mean, it's already hard enough enforcing very strict guidelines of this is what you do and this is what you don't do, and making sure that staff has the ability to go into as many pharmacies as possible for those very strict guidelines. And in this, when it comes to staffing levels and whether or not they were reduced directly related to this sort of thing, it's a much more gray area that would require a lot more investment on investigators' time. So those are a couple of the things that are rising to the top for me. In the end, the top line of my concerns is I'm just very concerned about a race to the bottom on staffing in order to increase profit at different pharmacies.
Yeah, great comments, Trevor. I absolutely agree. Yeah, go ahead, Jesse.
Sorry, I just thought of one other thing too. As this discussion happens, and just thinking throughout COVID in the pharmacies, we were essentially begging for extra staffing, and we know there's no pharmacist shortage. There is a technician shortage, but there were plenty of pharmacists who could have been hired. And I'm struggling to understand why many retailers didn't hire another pharmacist who could have been working remotely in an actual pharmacy and potentially been going in and out of being able to assist the pharmacies that actually needed help. And so I just wanted to kind of point that out there too. It's, there's remote work, of course, but there could have been other positions opened up that actually could have helped with the on-ground tactile work within the pharmacies and still be able to help remotely at other locations.
Right. Yep. Thank you. Thank you for the comments, guys. All right. We're going to open up for public comments on this specific item about the PIC provisions. But I know it's hard to keep up with it, so I would understand if the comments are a little bit out of the each comment item that we're discussing. So Elizabeth, ready for you?
Yes, the Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the question mark inside of the square, type comment, and send it to all panelists. For those calling in, you can raise your hand by pressing *3 from your phone to raise your virtual hand. So at this time, we have a few requests. I'm going to set the timer and call on this first individual, Mark Johnson. Let me find your login and send you a request. Request has been sent.
With CVS Health, I was having a little technical difficulties during the last comment period, so excuse me if I'm a little bit behind here and might not get to the PIC comments until the next period. But previous testimony from hospital and community pharmacy has described decades of remote work that was authorized by the board pursuant to the longstanding definition of pharmacist, which allows for the practice of pharmacy within or outside of a pharmacy. Without any stated incident and disregard for historical knowledge, this board has issued a new interpretation which is contrary to the standard of care both in California and across the United States. Approximately 45 states allow remote pharmacist work, and most have allowed, just like California has, with a one-liner. This two-page proposal drastically overrates common practice, and CVS Health again suggests that the board simply reverse this new interpretation and revert back to the prior board's position. The board recently heard from a few of the many remote pharmacists who are about to lose their jobs on May 28th if they cannot work within the confines of a pharmacy. As there will be no remote allowance in California, these specialty jobs will move out of state, as these pharmacists served patients across the country, not just California patients. Again, for the pharmacists who cannot return to the pharmacy, these specialty jobs will not be moved into the confines of a pharmacy located in California. In addition, CVS Health community pharmacies have enjoyed remote pharmacists balancing their workload by performing DUR and data entry verification. This program will be disbanded on April 30th, with pharmacist jobs evaporating and the work moved back into the pharmacy. The California Board of Pharmacy is driving jobs out of California and increasing store pharmacist workload. In spite of all of this, if you continue on this path, I ask you what you mean by other pharmacist clinical services authorized in this chapter in A1. This phrase is very similar to the definition of pharmacist. A pharmacist is entitled to practice pharmacy within or outside of a licensed pharmacy as authorized by this chapter, which is the exact board reinterpretation phrase that has created this issue. So it appears that authorized by this chapter refers to existing statutory references to remote work, such as pharmacist work in a skilled nursing facility, and not all other clinical pharmacist services, such as immunizations. There is no authorization in the chapter for immunizations to occur outside of a pharmacy, and patients can't enter a pharmacy. So if I understand correctly, on May 28th, the California Board of Pharmacy is effectively ending pharmacist immunization and many other clinical services, such as advanced practice pharmacists. I was hoping we could have a little bit of an answer on this very important topic.
Seconds.
Thank you.
Thank you for the comments, Mark.
And next individual, Jassy Grewal. Jassy, I'm going to send a request to unmute your microphone. Request has been sent.
W Western States Council. I'm here to speak on question 2 in the board's discussion. I really just want to echo support of the comments by Board Member Crowley and Board Member Chandler on the provisions around the PIC having to sign away their ability to be able to do this. We have significant concerns about retaliation for PICs. Retaliation can be seen as in the form of a demotion, hours cut, or being put on as a floater pharmacist, which are of significant concerns to our members without the proper retaliation protections included in this proposal, which I know is not necessarily within the board's wheelhouse, but are important considerations that need to be made when requiring PICs to sign a form such as this. What we have seen in practice around this is that the employer will just find another PIC who is willing to sign this form and move the individual who is not to a different facility that may not be of the worker's preference. Additionally, the requirement in this proposal requires the PIC to look at staffing and make sure that staffing is not decreased. But how is a PIC supposed to do that if they are not purview to staffing decisions that are made at the corporate level and that is not disclosed to the PIC? So while the intent of that language may seem notable, in practice, we don't see how that will actually be utilized to the benefit of the pharmacist within the chain setting. I will save the rest of my comments and my general comments for later on, but really appreciate you all allowing us to make comment today.
Thank you for the comments, Jessie.
This is the moderator. Moving on to next individual, John Gray. I'm going to send a request to unmute your microphone. And for those raising your hands, we will get to you here shortly. Thank you for your patience.
Hello again. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. Just want to comment as well on the discussion around the PIC attestation. Well, we believe it is reasonable to ask the pharmacist in charge to attest to the need for pharmacist remote work in his or her pharmacy. We are concerned about the proposal to have a pharmacist in charge sign a determination under penalty of perjury that reliance on remote work will not be used as a means to or lead to reduced staffing levels in the pharmacy. As I think you all know, business conditions are dynamic and may necessitate changes in staffing at any time for any number of reasons. For example, if a nearby medical practice were to either move into or move out of the area that the pharmacy services, if the pharmacy relies on that practice for a significant portion of its business and it were to move away, that may necessitate a change in staffing. We agree with Board Member Crowley's comments that it would be nearly impossible for the board to adjudicate the reason that staffing changed. And so therefore we recommend that the requirement to make an attestation related to pharmacy staffing be removed from the proposed statutory language. Thank you very much for the opportunity to provide comments.
Thank you for the comments, Dr. Gray.
Next individual identified as Christopher Atkins. Dr. Christopher Atkins, I apologize. I'm going to send a request to unmute your microphone.
Christopher Atkins. I am a community pharmacist, and I will comment on probably, I think the most important part is having the PIC have the authority to determine whether they would like remote processing in their pharmacy or not, because they are supposed to be the pharmacist in charge anyway. So I have met a few pharmacists that I think would be concerned with just kind of, quote unquote, random pharmacists verifying prescriptions at their pharmacy. And that's usually lower volume pharmacies that don't really need the extra help. I think the biggest benefit here for the remote processing is the ability to have smaller pharmacies help larger pharmacies, or maybe off-site pharmacists help larger pharmacies. I think that's where the biggest benefit comes in, because I have been at a few high volume pharmacies where it is very difficult to do anything other than process prescriptions during a day. Sometimes even giving like a vaccine or even counseling a patient is almost impossible. I mean, not to mention taking your breaks. I mean, I just assume that most pharmacists don't take their breaks at this point, but that kind of goes out the window also when you're just sitting there processing, and then any point that you pull yourself away from that, you kind of feel like you're taking 2 steps back almost. So this would really help alleviate the pharmacists that are pretty much just processing all day long in very high volume pharmacies. But sorry, the PIC should have the authority to determine if they feel like their pharmacy needs the remote processing help. And there should be, data security, obviously, concerns for pharmacists outside of an actual pharmacy doing the processing, that they're not on a secured network or something. that would be a little bit of a concern. But as far as a pharmacist working in a lower volume pharmacy, helping a larger volume pharmacy, which I have done, I feel like that's a pretty good process. And I feel like I'm able to concentrate on my work more doing that because I kind of have one job. I don't have to worry about counseling patients and doing vaccines because the main pharmacist is doing that. And then the pharmacy that I am helping doesn't have to worry as much about verification, so they can go do the vaccines and everything. So it has been very helpful from what I've seen in the community setting, at least for me. So that would be my main comment. In regards to Mark's comment, I don't see how this would affect pharmacists doing vaccines or anything like that. That kind of seemed overstated, and I'm not really sure what it was related to in this point, really. But that was my main comment, and I'm not sure how we would see if this does affect staffing levels. That is a concern for me, and also larger retail pharmacies intimidating pharmacists into signing this, basically, because I know they are doing that with like lunch waivers and overtime waivers and things already. So I would assume that that's probably some coercion would go into effect there, and how you would enforce that, I'm not really sure, but that would be a concern for me also, is just the coercion. The PIC being able to make the decision to have that in effect is a very important point. And overall, I would just say that it is very helpful, and I think we should continue this, maybe with some.
And the 3 minutes were up.
Thank
Next,
you for the comments, Dr. Atkins.
and next individual, Suzanne Bonilla. I'm going to send a request to unmute your microphone.
CEO for the California Pharmacist Association. I would associate many of my comments with Dr. Atkins, who just spoke, and wanted to also share my appreciation for the board's comments and thoughtfulness around the dangers of inadvertently reducing staffing levels and making it clear that there is no shortage of pharmacists available in California. I think that this is an issue that we see over and over again, is the staffing question. And I'm hopeful that the board can continue to wrestle with this. I don't have an answer. I don't think there is an easy answer. But we do know that we have enough pharmacists, and we know that our pharmacies are currently have tremendous wait lines, and maybe consumers are not being served as well as they could be. So I do encourage the board to continue to wrestle with this until we can find a solution that would provide adequate staffing along with the ability to use remote staffing when appropriate. Thank you so much.
Thank you for the comment, Susan.
This is the moderator. No further requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. Thank you, Elizabeth. With all that comments, members, any thoughts before we move on?
Hi, Sung. Yeah, my one note is that from what I'm hearing, it sounds like these remote pharmacists are not, at least in some companies, will not be given the opportunity to work remotely from a licensed facility. And I just want to say that I find that surprising. You know, I know that a lot of these remote pharmacists don't have the ability, and for X amount of reasons, that, you know, the complete remote aspect gives them full flexibility. But, you know, I'm surprised that they don't even have the option. I just wanted to kind of point that out there, and I hope maybe some of their employers will reconsider that and consider that remote work from a licensed facility is still very helpful for a lot of pharmacies.
Agreed. I think for me, just also adding on to that, what would help me understand is just some context. Like if you can provide like some specific numbers of how many employees that are working in remote setting, on what kind of functions, around what parts of the country, or what part of the state, it really would help. It just, you know, kind of, it doesn't help if you just say that they're all just gonna, you know, overnight it's gonna be shut down, or it doesn't help us really. It helps if I understand better context. So I beg you to just kind of provide that information to Anne Sodergren And if there's anything available, please, I ask you to do that. Thank you, everyone. Moving on to the next concept is to specify that a pharmacist performing remote processing must identify the specific location from where the remote processing will be performed. Further, the pharmacist would be required to provide consent for the board to inspect the location. To me, I think this is a very important concept to add because I know we're kind of focusing on the large chain pharmacy in this discussion, but I'm also concerned about possible rogue players out there that, maybe, doing things that would be very inappropriate. So I think that we need to have this information for us to even consider. But I just feel very strongly, but I'll open up for members. Your thoughts?
Yeah, Sung, for me, this gets back to the logistical feasibility of the entire process and thinking it through from a logistical standpoint. Because I guess one question I would have for Anne or for staff is for the folks that have been doing remote processing currently, have there been any inspections ever of any remote processing sites as it's been happening since it's been allowed?
No, at this time, there's no requirement for them to notify us of where the remote processing is occurring. So that the waiver didn't include that. I'm not aware of, but I need to check in with staff on whether or not we have had any investigations stemming from HIPAA violations.
Okay. And with our current level of inspectors, typically, this is a question out of personal ignorance for the specific logistics of it all. So apologies if I'm asking a basic question, but when we license a facility, when we license a pharmacy, the fees that go to paying that pharmacy go to pay for the inspections. I mean, the fees inform that, correct? And so if we're adding a whole nother layer of places to be inspected, how does that impact the potential expansion of how many inspectors we need to hire, the cost to the board overall? Because as of right now, folks are paying fees which pay for their inspection basically. And if we're now allowing folks to do this work remotely that is open to inspection, but is at an additional cost with no additional inflow for us to pay for these inspections, how that affects the board's bottom line.
I'm going to jump in. I didn't know if you wanted a potential response, so I'm just going to jump right in.
Please.
So I don't think that it would be necessary to do routine inspections of these work sites unless the board believes otherwise, right? We take our guidance from you all. So I don't know at this point that the staff would be recommending routine inspections or random inspections of these, where I think that the inspection of the location would most likely be occurring is where there's a triggering event, an investigation or something like that, that would require the board to be going out there. Having said that, if the board says, no, we want staff to, randomly inspect, I don't know, 1%, 2%, whatever that is, then yes, that would probably have a workload impact depending on what the guidance from the board was.
Okay, thank you.
Thank you for the comments, Trevor. Great comment. Jesse, any comments before I open up?
Yeah, I will just say, and I'm not super tech savvy, so maybe someone in the comments and public comments will be able to answer this, but I'm a little concerned if there is technology that will make it appear as though someone is working within the state of California, but they aren't actually in the state of California. So how do we actually have the security to ensure the location of where someone's actually working? And in terms of the inspection issue, I think what Anne is saying makes sense. Just it would be like not feasible to inspect every remote location, but just thinking in in current news and thinking of the recall of several eye drops that were over the counter that have been traced back to a facility in India where the FDA did an inspection and found several issues. My only concern is that it really takes something catastrophic for an inspection to happen, and we just really have no idea what the conditions are at someone's home or other location where they may be working. So that does raise some concerns of the feasibility of not being able to do inspections or only doing them in response to something terrible happening.
Great comments, Jesse. All right. With that, we're ready for public comments. Elizabeth?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click the question mark inside of the square, type comment, make sure it goes to all panelists before clicking send. Or if you're calling in, press *3 from your phone to raise your virtual hand. We do have a few requests. I will be going in order. Thank you so much for your patience. The first individual, Timothy Kutler. I'm going to send a request to unmute your microphone. Give me just a moment as I locate your microphone. Request has been sent. And you're unmuted.
Thank you very much. This is Tim Cutler, UC Davis, Assistant Chief Pharmacist here, overseeing our clinical pharmacists in our remote settings, processing, or rather remote ordering medications and working under the auspices of our clinical practice that we have established here for a really long time. I'm just wondering overall the purpose of most of these requirements, because I see this as something that I think Mark Johnston really spoke to well, which is a practice that we've had in place for a really long time. Statutes exist within the law that allow pharmacists to do this work. And now I feel like we have created a problem that didn't exist. And I'm seeing things throughout this discussion that sort of further illustrate the confusion and the complication, the unnecessary complication that's been created. And so I'm not sure what that problem is we're trying to solve with all of this additional information, when either we can continue the exact waiver as is that's working well, that doesn't seem to have any problems, and I'm not sure what information the board's receiving that it is creating problems, but I feel like we're continuing to try and solve something that does not have a problem that needs to be solved. And so therefore, we have a lot of very complicated thoughts and even proposed draft legislation that's fraught with issues that we're now seeing a lot of interest in public comment because it's creating problems that did not exist before. So that is sort of the central piece I'm trying to understand, and I do appreciate the board wrestling with these issues, but I'm failing to see what the issues are that we're trying to sort of come up with these solutions. Specific to this requirement, we have pharmacists working from home remotely. So I'm just not sure how or why the board would be involved in inspecting their house. I'm not sure that pharmacists, would want that either. We have requirements that we have within our institution, within UC Davis, that require certain things to be met, including security, including VPN, including all the, public, or rather HIPAA requirements related to protected health information. So we have policies and procedures that we also adhere to, that we're required to adhere to. So we already have a process for that. We also have pharmacists in multiple buildings across our sites that do this work. So they're both in our sites that are not always licensed facilities, but also at home. And I don't have the ability nor the desire to go inspect all of the locations. It also would be burdensome to just list one location, because we do have pharmacists working throughout our different facilities. So overall, I think the summary I'm just really, really encouraging us to consider is just making the waiver permanent and not creating new problems and new statutes that create more confusion
10 seconds.
and more oversight by the board that would be overly burdensome to the board to enforce.
Thank you for the comments, Dr. Cutler.
Individual identified as Jassy Grewal. Jassy, I'm going to send a request to unmute your microphone.
Hi, hello again, Jassy Grewal with UFCW Western States Council. I want to expand on some of the concerns that Board Member Chandler has raised, and some of, in response to the executive officer's comments around enforcement. I think we have significant concerns when it comes to enforcement. This proposal has consumer and patient safety protections. But if the board is not able to enforce those protections, what is the point of even having those in a proposal? Enforcement is necessary to make sure that the intent of the law is being enforced, specifically around those patient and consumer protections. We know that enforcement and implementation of laws has been difficult. We have seen this happen in real time with Senate Bill 1442 and Senate Bill 362, who have been in law for years now, and we are still struggling to have those bills be enforced in the community change setting. And so I think hearing the comments from the Board of Pharmacy around enforcement and needing quote unquote triggering events to be able to do that is of significant concern to UFCW because of the reliance on the protections and provisions in the proposal to really protect our workers and consumers. We would also be very interested in seeing the current board's capacity to enforce. How has the board been able to do proactive enforcement of its licensed facilities? Does it have capacity to even go inspect at triggering events, to do those proactive inspections and make sure that these laws are being complied with, ensuring that these remote pharmacists are even working in California and not working outside of the state and serving patients outside of the state. So for all of those reasons, we have significant concerns with the lack of enforcement for this proposal.
Thank you for the comment, Jazzy.
Next individual identified as John Gray. John, I'm going to send a request to unmute your microphone.
Hi, good morning, John Gray again, registered pharmacist with Kaiser Permanente. Thanks for the robust discussion on this. First of all, I just want to echo the comments that Dr. Cutler from UC Davis made. We agree that, the current remote processing waiver for pharmacists and technicians is working well, and believe that that really ought to serve as the framework for a statutory proposal for pharmacist and ideally technician remote work going forward. Speaking specifically to the pharmacist consent, we are very concerned about the proposal to have each pharmacist who is performing remote processing execute a consent acknowledging that the board may inspect their remote work location, which in many cases would include their home. This reads as though the board is asking pharmacists to preemptively waive their Fourth Amendment protection under the United States Constitution against unreasonable searches and seizures, which generally applies to searches and inspections in non-criminal matters. As you probably know, the basis of the Fourth Amendment really is that, an individual has protection within their home from these kind of unreasonable searches and seizures. So this element is very concerning to us, and we strongly recommend that this requirement be removed from the proposed statutory language. Thank you very much for the opportunity to provide comments on this topic.
Thank you for the comments, Dr. Gray.
Next individual, Charles Daniels. I'm going to send a request to unmute your microphone.
Good morning again, Charles Daniels, University of California, San Diego. Couple of comments with regard to the proposed language. In paragraph B1, we recommend that you revise to allow the use of biometrics or equivalent ID verification authentication technology and do not prohibit the use of portable electronic devices, laptop computers. Many pharmacists currently use these portable devices, and they have appropriate security and dual factor authentication so they can move to different locations throughout our health systems and continue to do their work. Furthermore, in paragraph B2, we believe that the standards for remote practice record keeping should be the same for community pharmacies and pharmacists working remotely on behalf of hospitals and clinics. Doesn't appear to be clearly stated. Thank you.
Thank you for the comments, Dr. Daniels.
Next individual identified as Lindsay Gillahorn. I'm going to send a request to unmute your microphone. Request has been sent.
Hi, thank you. Lindsay Gillahorn, again with the California Community Pharmacy Coalition. I'd like to echo the comments of both Dr. Cutler and Mark Johnston. Although COVID brought the benefits of remote work to light, I think for many of us, remote processing has been practiced in California long prior to the pandemic, with no evidence that I'm aware of any issues. So in terms of enforcement, the board has tools at its disposal now to do inspections and enforce violations. And that authority has in fact been increased significantly over the past couple of years, including a substantial increase in the maximum fines imposed on chain pharmacies for violations. In addition to that, in terms of staffing, which has been discussed, one of the primary reasons for remote processing is to actually assist with pressure in the pharmacy because of some of the current limitations around staffing in California, including the limited pharmacy technician ratio. Remote processing is a way to help this. Even though there might not be a pharmacist shortage in California, many of our members are having difficulty finding pharmacists. Even with recruiting, signing bonuses, it has been difficult to find pharmacists. So we really think remote processing is one way to assist this. So again, appreciate the discussion. We would also just urge the board not to narrow this proposal too significantly. We want to ensure pharmacists working remotely can continue to do so as they have done safely and effectively for several years, and continue to perform these functions that are meaningful to patients and assist with reducing pressure in the pharmacy. And President O, in terms of your request for some data, I will look into that and see if we can get some information to you on the types of work that is being performed. Thanks.
Thank you, Lindsay. Thank you for the comments.
Next individual identified as Mark Johnson. Mark, I'm going to send a request to unmute your microphone.
This proposal is not in harmony with common practice. For example, a remote pharmacist does not commonly work for a sole pharmacy and a sole PIC. Many remote pharmacists are providing key relief during key spikes in work for many pharmacies in a single remote pharmacist shift. Perhaps a reasonable alternative is to give the PIC the ability to refuse remote services, which arguably they already have. They are the PIC after all, or have the PIC sign up for remote services in some sort of agreement, but to have an agreement between a PIC and a pharmacist, it just simply isn't the way that remote work works in this day. This whole proposal is really the opposite of the visionary allowances that the California Board of Pharmacy used to frequently lead the profession with. CVS Health, again, asks you to save jobs in California, especially for those from whom we heard of with disabilities and certain family responsibilities, and reduce in-pharmacy workload by abandoning this effort and reverting back to the board's prior historical interpretation and allowance for which many successful and safe business practices have been built upon. And lastly, there is a large disconnect that many of us believe in clinical services. I've heard from Dr. Atkinson today and the board in the past that perhaps clinical services are allowed, the practice of pharmacy. The board's interpretation does not allow for that. I implore the board, if you think immunizations can happen out of a pharmacy, if you think an advanced practice pharmacist can work outside of a pharmacy, would you please state that so that those duties are not abandoned on May 28th? As I read this proposal, the only thing that's allowed to be done outside of pharmacy are the duties that are listed in A1. Immunizations is not listed in A1. Could we please have a statement that immunizations and cognitive services still exist after May 28th? Thank you.
Thank you for the comments, Mark. Appreciate it.
This is the moderator. No further requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. Members, any thoughts and comments before? Okay.
Hey, Sung.
Go ahead.
I was just curious if Eileen had any thoughts about the comment regarding the someone's Fourth Amendment rights under the U.S. Constitution, and whether this would contradict that in any way from like a lawyer's perspective.
Hi, Member Crowley. Thank you for asking. No, I do not believe it would. You're talking about balancing a pharmacist's reasonable rights for privacy against maybe patient information that could be printed at their house or some other place. I know the federal government has got similar things. I worked for them at one point where you worked at home and you did consent to inspection by those type of authorities. So no, I do not agree with the Fourth Amendment comment that was made. I think it's balancing a pharmacist right against patients' rights. If you have the ability to print out confidential information at your home, that you're not saying that people are going to show up on your doorstep with guns. You are just agreeing to the fact that your house or wherever you work remotely would be subject to inspection if board inspectors came in to look for that. And that might be necessary in the context of a HIPAA violation, or if somebody's personal information was compromised by somebody working from home.
Great, thank you.
And Eileen, could you briefly, I know this has been discussed at many or at several other of these meetings, but could you address in whatever context you feel necessary about the alleged change in the board's perspective on remote work, as well as our authority under statute to extend the current waiver?
Thank you, Member Chandler. No, this is not a new interpretation by the board. The whole reason that we issued the remote processing waiver is based on the structure of pharmacy law. As people keep referring to the definition of a pharmacist, that they can work inside or out of a pharmacy, there's a big proviso that says, as authorized by this chapter. So in this context, statutory changes to be able to implement, definitely for pharmacy technicians, there is no current authority for them to do anything remotely outside of permanent pharmacy law. Pharmacists are narrowed to remote order entry when it comes to processing of prescriptions, dispensing. We do not have the power to extend this waiver beyond May 28th. As you know, the elected officials of the state of California have given this board quite a lot of power during a declared public emergency to waive pharmacy law, but they put a tail end to that at 90 days after the end of the declared emergency. Governor Newsom has declared the public emergency in California to have ended on February 28th. So our power is limited once the public emergency has ended, and we've been very clear all the way during the course of this pandemic that our power would run out eventually, and the maximum time period is 90 days after the declared emergency. Does that answer your questions, Member Chandler?
It does, thank you.
Thank you, Trevor. Thank you for the questions. I really appreciate it. Just again, I think we're focusing on remote processing today, remote processing, not pharmacist services. So I'm going to take a quick break. It's 10:18. We'll take 10-minute break. We'll come back at let's just come back at 10:30. So we'll come back at 10:30. See you in a little. Quick little break. We're getting ready to start again. Just want to make sure everyone's back. I don't see their videos are on, but Trevor, are you back? Jesse, are you back? I see you.
Hi, Sung, I'm back.
Thank you. Trevor, are you back?
Yes.
All right. Thank you, guys. We'll get started here. The next concept, get right back on it, is fourth one. is that policies and procedures would specify the authorized functions that can be performed. I note that the proposed statutory language would provide the authorized functions, but the PIC would determine which of those functions could be performed remotely. Also note that the policies must include provisions to protect confidentiality of patient information and the training be provided. I believe, again, this is a good place to start. But considering from some comments heard about the PIC involvement, maybe we'll have some comments on those. So interested to hear your thoughts, members. Go ahead, Jesse or Trevor.
Yeah, I think this kind of goes to what I was saying before, in that a PIC, particularly at a chain setting, is not involved in the policies and procedures, and so this may be a difficult thing for them to be involved with. I think it goes without saying that there should be policies and procedures, and I imagine there already are policies and procedures at most pharmacies in regards to protecting confidentiality. I will say the training is pretty vague, and from what I've heard across different chains, sometimes it sounds like sometimes training needs to be specified, but because the remote functions may vary and the systems are different, I don't know if there needs to be something outlining on the job training or something like that. But yeah, I think all of these things are necessary to consider when moving forward with remote processing.
Thank you, Jesse. Trevor, any thoughts?
No, I have nothing to add to what Jesse said.
Thank you, guys. Elizabeth, please open the line for public comments.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click the question mark inside of the square, type comment in the text field and send it to all panelists. You can raise if you're calling in, you can raise your hand by pressing *3 to raise your virtual hand. I do have a request, and I'm going to set the timer. I have a request from Charles Daniels. Your mic has been unmuted.
Thank you, Charles Daniels, University of California Health. A few additional comments for the group. With regard to paragraph C, we recommend that you revise to require privacy reporting consistent with applicable federal and state laws. Do not require separate and independent reporting of privacy incidents to the Board of Pharmacy. Second comment, with regard to paragraph D, clarify that this language also doesn't restrict or remove other provisions of the Business and Professions Code that do allow these types of activities. And third, in paragraph E, any applicable fines or civil penalties for violations related to remote functions should be the same as penalties for similar pharmacist or pharmacy technician activities that occur within the licensed pharmacy premises, not more. Thank you very much.
Thank you for the comments, Dr. Daniels.
This is the moderator. No further requests. Would you like me to close the Q&A?
Yes, please. Are we sure? That's it? Okay. All right, moving on to members. Any comments after that? All right. So final two provisions speak specifically to citation authority related to unauthorized disclosure, as well as authority for enforcement action and penalties for violations. You'll note that the fine amounts would be progressive based on subsequent violations. This approach is similar to provisions related to unauthorized disclosure of medical information established in the Civil Code. Members, I agree with the provisions and proposed authority. I believe sufficient fine authority is necessary to serve as a deterrent to violations. Thoughts, members? Any comments?
I would say just one thought with all of the, because this has been a consistent, especially during the last conversation, the previous meeting, is I know there's a lot of like the VPN work that's been done, and there's consistent privacy standards that are already in place. I think this one is particularly important, especially here in the Bay Area. Oakland just had the ransomware attack, and we constantly see, in some cases, credit card companies delaying notifying their consumers. And so this, especially from a consumer protection angle, the data end of things is incredibly important in making sure that there is there is a full structure in place similar to structure that's there for credit card companies or for other sensitive data companies, that the requirement of not only notifying the board but notifying their customers, figuring out a way to balance that will be important.
Thank you, Trevor. Jesse?
Yeah, I did have some questions about the language as it exists, and specifically like what in a current means, and is that for a particular pharmacy license? Because I mean, the problem with the remote work is that one pharmacist can be working at several different locations. So who exactly is paying that penalty? Is that the licensee as like the individual? Is it the pharmacy license? And if we're noticing a pattern across the same chain, for example, or the same pharmacy that may have different locations, is this like one occurrence per license or per company or pharmacy? I think that was just the one question I had on in terms of what the intention of the penalties were.
I'll let Anne speak to that. Sorry to put you on the spot, Anne.
So Jesse, I think probably as written, it would apply to the entity itself as opposed to the corporate ownership. So I think it's like throwing something out there and then getting feedback. So if it's like, if it's the same violation that occurred under, common ownership kind of things, we just update the language. I think it was just kind of like, how do you feel about progressive fines? Similar to what they do in the civil code. Do you like that in concept? And then how would you like to see that sort of, implemented if the board did move forward with legislation? Like, what would that look like?
Okay. So I do like the idea of progressive fines. I think we do need to have more discussion in terms of what that looks like for multiple locations, not even just chains. You can have an independent that has a few different locations, and chances are if there's something occurring at one facility, it's happening at all of them because the policies and procedures will be the same for remote processing. And so I think that's something that we need to have further discussion on moving forward.
Thank you, Jesse. Thank you, Anne. All right, we'll go for public comments. Moderator, please open the line for public comments.
This is the moderator. The Q&A is now open. Instructions are on the screen. If you would like to participate, click the question mark inside a square, type comments in the text box and send it to all panelists. You can also raise your hand if you're calling in by pressing *3 from your phone to raise your virtual hand. I do have a request from John Gray. John, I'm going to send a request to unmute your microphone in just a moment. Request has been sent.
Thank you. This is John Gray again from Kaiser Permanente. Apologies. I thought we were doing subpart B in the statutory language separately, but it looks like that was part of the last comment. So I do just want to echo on that piece. I do just want to echo the comments made by Chuck Daniels earlier that the restriction on we do have some feedback on the restriction on the use of laptops. Organizations may choose to use laptops for reasons of affordability or contracting from an enterprise perspective. I, for example, use a laptop, although it's plugged into a dock and 2 monitors and never moves. So I think the restriction on using laptops could maybe be refined in some way to allow organizations the flexibility to choose the devices that they want to issue to their employees. If the board keeps the requirement to for a pharmacist to kind of designate their remote work location or locations, maybe something along the lines of the pharmacist can't work from locations other than the designated locations, or something that doesn't speak to the nature of the devices being used, but rather, what really is the board trying to get at with that provision. On the HIPAA reporting, on the breach of information reporting, we would also echo Chuck Daniels' comments that we would be more supportive of a provision reiterating the requirements under existing law to report breaches rather than establishing a new breach reporting requirement under the pharmacy law. And then lastly, just to clarify our previous comments on the Fourth Amendment, we don't dispute that the board can seek to establish a requirement for pharmacists to waive their Fourth Amendment protections against unreasonable searches. Our concern is that such a requirement will have a chilling effect on pharmacist remote work. I know that there are members of the regulated public, myself included, who have reviewed this proposal, who have expressed that they would not preemptively waive their Fourth Amendment protections against unreasonable searches by consenting to have a board inspector enter their home at any time. So, to the extent that the board feels that this is necessary, that pharmacist remote work is necessary and ought to be used, we just think that that waiving Fourth Amendment protection would be chilling in many circumstances and would reduce the usefulness of the statute. Thank you very much for the opportunity to provide our comments.
Thank you, Dr. Gray.
The next individual, Lindsay Gullahorn, I'm going to send a request to unmute your microphone.
Hi again, thank you. Lindsay Gullahorn with the California Community Pharmacy Coalition. I just wanted to address one question raised by Board Member Crowley with respect to after the waiver, pharmacies allowing remote work to continue to be allowed from a licensed facility. Totally understand what you're saying there. I think the issue for us, I've heard from some of our members, number one, a lot of these pharmacists currently working remotely, they have health issues or disabilities that can't be accommodated in the pharmacy, but they can still do their work from home. So they physically can't work in a pharmacy. So for those individuals after May 28th, their jobs will end because they just physically can't make it to a pharmacy. And then we have other members who are giving pharmacists the opportunity to come back to that registered site, but many of them live too far away from that site because this type of remote work has been going on for such a long time. So our members have hired pharmacists who live, many hours away from that pharmacy. And once the waiver ends, they will not be able to commute to that pharmacy. So unfortunately, there are a number of pharmacists right now who, after the waiver expires, just for many different reasons, will be unable to go into a pharmacy. So I just wanted to provide that clarification. Thanks.
Thank you for the comments, Lindsay.
This is the moderator. No further requests. Would you like me to close the Q&A?
Yes, please. Thank you. I'm gonna open up for one more time after I bring it back to members for any global comments for public. So members, any thoughts after this? My hair is getting whiter every moment, every minute we're talking about this and getting wrinkled, and it's just
Yeah, I mean, I have a
tough issue, but yeah, I'm hoping that we focus on how we move forward, because obviously that, we want to figure out a way to move forward.
yeah,
Go ahead, Cooper.
and that's my thought. I mean, I come at this from obviously the public perspective and with a background in public policy and legislation. And my thoughts on this, I mean, I've obviously voiced my concerns over and thoughts on a couple various different points here. But on the practical matter of things, as it's been talked about multiple times over multiple meetings that this is a legislative effort. There has been a legislative attempt previously that failed significantly in the legislature. And so that was something that the board put forth as a recommendation. It got a co-sponsor and an author, and it failed. And now we're having this conversation. And so we are the proper venue to be having these incredibly important conversations. We are the Board of Pharmacy. This is a pharmaceutical issue. But one of the areas that causes me some consternation during having these important conversations is the assumption that the board somehow has a unique, all-powerful ability to extend this waiver or to simply put out a statement and make something happen, where all legal advice has been contrary. And the fact is there's already precedent that we know we don't have this because we've actually sponsored and pursued legislation that has not passed. And so all of this is to say, I think it's important we're talking about it. I think it's important that we're getting more expertise so that when the legislature does call on us, whether we do put forth legislation, sponsor legislation again or not, that we are well versed in it and we can speak to our experiences based on the significant feedback we've gotten from all across the board. But this is going to have to be solved by the legislature. And the clock has been there from the very beginning. The governor has made clear what the time frame is for the expiration of the state of emergency. And so that's where I'm trying to like navigate all of this, is obviously as a board, in being responsive to listening to, filtering, and making sure that we are advocating for the consumers of California, is just knowing that this is something that has to be done legislatively. And let's say right now, or at our full board meeting later this month, we decide to have a vote and say, yes, we hope this passes. The introduction period has already passed. There's always a bunch of different legislative maneuvers. But again, even if all of those legislative maneuvers were to happen, which is in itself a very complicated and nuanced thing, there is no, based on precedent on the last time something like this was introduced, it will fail in the legislature overwhelmingly like it did last time. And so I think when in these conversations with advocates and talking with folks who are very passionate, but rightfully passionate about this, because this is an incredibly important issue, is that this is something that our elected officials and our appointing authorities and all of these folks, this is where this comes to. And so that's how I'm trying to process, as you ask about a way forward, is do I want the board to be a part of that path forward? Absolutely. Politically, logistically, legislatively, are we the venue where this is going to happen, or the make or break conversations are going to happen? I don't see that currently. And so that's where my the tension with me in this conversation is.
Thank you, Trevor. That is very, very well said and very helpful. And I think it's great for you to say it, also for all of us to just kind of acknowledge it. Totally agree. Jesse, any thoughts before? I'm gonna.
Yeah, one final thought on a language piece under D. I will just say the language as it's presented now, and this has to do with final product verification. So it says this subdivision shall, nothing in the subdivision shall authorize a pharmacist to dispense a drug or perform final product verification via remote connection or without being present. The without being present part is a little concerning to me, because it makes it sound like the pharmacist just has to be within the pharmacy, but not actually doing the performing. So moving forward, if we're taking a look at the language, I would hope that we look at that a little more. As we continue the discussion moving forward, I think we need to have more conversations, particularly when it comes to specialty versus a traditional community setting, and just hoping that we get more data information about where this is happening, how often it's happening, whether or not community pharmacies even realize that remote work is happening within their facilities as it exists under the waiver today. Some of those questions I think we really should hear answers on as this discussion moves forward. I was a little surprised, honestly, to see some of the statutory language being proposed today, just because I think after our last meeting, we kind of didn't really come to a consensus. But the last thing I'll leave with is that I just hope that there is room or space for pharmacists who may be potentially losing their jobs after this waiver ends to at least be given the option for a remote position within a facility that's close to them if possible. I know that's not realistic for a lot of people, but I'm just gonna kind of leave it at that.
Thank you. Thank you, Jesse. So question 5 and 6 kind of are clumped together. I think we can proceed to the next slide there. Yeah, so it's actually clumped together on the next. So just because of that, I'm gonna open up for opportunity for public comment on global statements anyone wanna make as stakeholders. I'll open up for one more time as a closing section of this agenda item. So Elizabeth, if you could please open up for public comments. Just
Yes.
overall, any global comments about remote processing, please feel free to speak.
Yes, the Q&A is now open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click the question mark inside of the square typically located bottom right corner of your WebEx screen. And in the text, type in comment, make sure it goes to all panelists before clicking the send button. If you're calling in, you can press *3 to raise your virtual hand. At this time, I am going to send a request to unmute John Grubbs' microphone, and I'm setting the timer here for 3 minutes.
Hello?
Hello. I can hear you, Dr. Grubbs.
Yeah, President O, I'm with you. If my hair could get any whiter, I think it would be, because this is really a very, very concerning situation for us at the University of California. We feel like that if, when the waiver expires on May 28th, our ability to provide the high quality care that we're providing to our patients today is going to be severely impaired. And I would just say that
I think we lost you, Dr. Grubbs. We lost Dr. Grubbs, right? Okay. Cannot hear you, Dr. Grubbs.
This is the moderator, Dr. Grubbs. On the mute button, there's a down-facing arrow. If you click on that down-facing arrow, a pop-up menu will appear. And from that pop-up menu, you can select a different microphone under the microphone selection. And Dr. Grubbs.
He's muted again. Yep.
I sent a request to unmute you, Dr. Grubbs.
I apologize.
There you are. That's okay.
I got cut off. I'm not sure what you heard.
Probably start at you can go after the gray hair part.
Okay, great.
Yep.
Yeah, I mean, we're very concerned about our ability at the University of California to continue providing quality care to our patients after May 28th. And we don't feel that the bill that's in the legislature today, nor the amendments that are being considered here today, are really going to address our needs and allow us to continue providing that care. But what I will say is that we are very anxious, open, and willing to work with the board to figure out a solution that, can allow us as well as others throughout the state to continue providing pharmacy care to their patients as they are today. So thank you.
Thank you, Dr. Grubbs. No other comments?
Moderator, no further requests. Would you like me to close the Q&A feature?
Yes, please. Thank you. Thank you, everyone. I know that this is such a tricky, challenging, extremely complex issue. We'll work with staff to update the language based on some comments today. And also we'll try to bring updated language to our next meeting. But I really am appreciative what our member Chandler has said about this being a legislative process eventually, and it will be a very complex issue as well. I just wish there was easier way, but at this point there doesn't seem to be. So we'll try to figure out how we can proceed and move forward. All right, next agenda item 5. Discussion and consideration of changes to the board sample CPA, collaborative practice agreement related to MAT, medication assist treatment, to remove the data 2000 waiver reference. Members, the meeting materials include some brief background on the development of the sample collaborative practice agreement related to medication assisted treatment. Given the recent changes at the federal level, it is appropriate to update the sample CPA to remove the reference to the data waiver requirements. Have confirmed with Dr. Gaspar, one of our experts for these issues, that that the proposed change is appropriate, as this is just a sample CPA, and I do not believe formal board action is required. Unless members have any concerns, I'll report at the some information during the board meeting, and unless comments are received indicating the changes are not appropriate. And I'll work with the staff to update the sample CPA on the board's website. Members, any comments or thoughts? Okay. Moderator, please open the line for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click that question mark inside of the square, type comment in the text field and send it to all panelists. Or if you're calling in, press *3 from your phone to raise your hand. No request. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth.
Thank you.
All right, moving on to the next agenda item 6, discussion and consideration of possible regulations to implement Government Code Section 16.5 related to digital signatures and development of policy statement to facilitate implementation of digital signatures on applications and other notices. Members, the meeting materials detail the relevant sections of law establishing the provisions for use of digital signatures, including Government Code Section 16.5, which provides authority for a public entity to accept digital signatures under specified conditions. Further, regulations define the 2 forms of acceptable technology that can be used. The board has received public comments seeking alternative means to interact with the board, including alternatives to a wet signature. As you may recall, the board is currently engaged in business modernization activities to evaluate future technology needs. However, in the interim, there are some interim steps the board can consider to ease some of the current challenges licensees and applicants report related to current wet signature requirements. You note from the meeting materials, staff are recommending the use of digital signatures that meet requirements of public key cryptography. Members, I strongly agree with the staff recommendations. I believe the draft policy statement is appropriate, and I welcome your thoughts. Members, any thoughts or comments on this?
Listen, I more just have a question, and I don't know if you or
probably
Ken
not
have
for
an
me. I'm not a technology
Well, no.
expert
I'm
on
just
this,
curious
but-
if other boards are already using the digital signature that we know of.
Ms. Soderbrand, any, do you know?
I don't know. I'm happy to survey some of the others. I think people have different requirements in both their technology solutions that we don't currently have because they're on different systems, so they may be integrated in that way as well.
Okay, thank you. I was just curious.
Trevor, any thoughts?
Just that I'm fully supportive of digital signatures. As staff knows, it took me a while to get my wet signature in for the certificates. And I am all about it. I think it's all, the policy statement is very straightforward, and yeah, so I support it.
If I had known that I could have bring this upon earlier, I would have done this. And so thank you, Anne, for bringing this to our attention. Appreciate it. So if the members are in agreement with the policy being recommended, We can't have a formal recommendation because we're a committee not with a quorum. So I'll work with the staff to draft possible regulation language for the committee and board to consider at a subsequent meeting. In the meantime, assuming members are in agreement, the board can release the policy statement as a means to convey the board's acceptance of digital signatures, which will bring it up for discussion at upcoming April board meeting. Moderator, please open the line for public comments.
Moderator, the Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click that question mark, type comments, send to all panelists. You can raise your hand if you're calling in by pressing *3. I'm going to set the timer. I have a few requests here. Lindsay Gillahorn, I'm going to send a request to unmute your microphone in just a moment. Request has been sent.
Thank you. Hi again, Lindsay Gillahorn with the California Community Pharmacy Coalition. Just want to say we are also very supportive of this. We think it's a simple, common sense action that will streamline our members' interaction with the board when signatures are needed, save time, and also reduce impact on the environment by allowing for electronic transmission of documentation to the board in lieu of sending documents signed via wet signature through the mail. So definitely just want to thank the board, thank Anne for considering this, and definitely support this moving forward. Thank you.
Thank you, Lindsay.
Identified as Rob Jedis, and I apologize if I mispronounced your name. Going to send a request to unmute your microphone.
With Albertsons Companies. I'm the Director of Pharmacy Legislative and Regulatory Affairs. Also have our licensing department that does report into me, and so I'm familiar with some of the processes that require these wet signatures, and wanted just to go on the record that we also support moving towards accepting digital signatures during COVID as a solution. We did reach out to many boards that require signatures on their forms to inquire whether they would allow for DocuSign or other digital validated signatures to satisfy those requirements. And we do have about half or more of our states that do require signatures on forms that do accept the DocuSign. Just to kind of paint the picture with a simple pharmacist in charge change today, we have to overnight the form to our pharmacist in charge that is assuming the role, and then they overnight that back so that we can make sure and marry the form up with the check so that when the Board of Pharmacy receives that form, they have the payment included, and it does not slow down the processing of that function. So having the ability to allow our PICs to do a digital signature would simplify the process for both the PIC in the store as well as our licensing staff that oversees the licensing of multiple locations across the country. So thank you for taking this up, and appreciate the further conversation, and hope to see this come to fruition. Thank you very much.
Thank you, Dr. Geddes.
This is the moderator. No further requests. Would you like me to close the Q&A feature?
Yes, please. Thank you, Elizabeth. All right, moving on to next agenda item 7, discussion and consideration of licensing statistics. The meeting materials include processing times as of March 24th, 2023. Attachment 5 includes statistics for the first 8 months of the fiscal year. The board has received over 9,300 applications and over 300 applications for temporary licenses. The board issued over 6,300 licenses, including over 1,500 pharmacist licenses, almost 2,500 pharmacy technician licenses, and 216 temporary licenses. I continue to monitor processing times. Unfortunately, we continue to have a number of staff vacancies in our licensing unit. Recruitment efforts are ongoing as new staff are hired and onboarded. I am confident application processing times will improve. Recent recruitment was completed and the position responsible for processing pharmacy technician application is now filled. I'd like to thank the licensing staff for their efforts and balance all of the various licensing programs through this time with all of the vacancies. We truly appreciate all of your efforts. And members, I continue to monitor recruitment efforts with Anne. Will receive updates to processing times during the full board meeting later this month. Members, any comments or thoughts?
Yeah, and I have just one question. Well, I have two questions, one specific and one general. When I was looking at the site applications, there's just the biggest aberration that kind of popped up is in July to September for the site applications for clinics, there seemed to be a massive surge in site applications for clinics from July to September, and there was a corresponding site license approval from January to March, about the same. So wondering, is there a reasoning for that? It just seemed like a big kind of aberrant number compared to the rest of them.
I apologize. I'll need to check in with staff. It could be that there was a large change of ownership, for example, involving multiple clinics. So you're typically doing the workload one time for several and just focusing on then site-specific things. So that can sometimes, create some kind of what looks like a surge.
Okay, cool. And that was my specific one. And the general one is, in these numbers, are there any trends you're seeing that should be brought to our attention as far as specific forms of licenses, specific data points you think are important for us to be paying attention to?
Yeah, so typically at the July board meeting and the July licensing committee meeting, we're going to do multi-year trends. Typically, they're 3-year trends, and then we can kind of look. During our last one, I think one of the things that really kind of stood out was a decline in intern applications for the schools of pharmacy, like a decline in those, and that's consistent with what we're hearing in terms of declining enrollment. But we'll really be kind of looking more, at multi-year comparisons to really kind of get to some of those trends as well.
Awesome. Thanks, Sam.
Thank you, Trevor. Any other comments? Okay, moderator, please open the line for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click that question mark, type comment, send to all panelists, or press *3 from your phone to raise your virtual hand. No requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. Okay, next and last, we're already here. Thank you, everyone. Our next meeting is scheduled for July 19th of 2023. Unless unforeseen circumstances come up, I expect that meeting to be in person in Sacramento. So hope to see all of you there. And we really appreciate all of your involvement and participation, all the members. Thank you for your time. And thanks to all the stakeholders coming to the meeting and speak on the issues that are so sensitive, technical, challenging. But please come back and voice your thoughts. And we always appreciate all of you. And thank you, everyone, for coming. The meeting is adjourned. We'll see you in a couple weeks. Bye, everyone.